Good morning to all our Support Fibro friends. Welcome. Happy Friday to everyone out there. We are streaming live to potentially a new audience. So if you're out there streaming and watching, please leave us a comment. Let us know where you're tuning in from, or leave us an emoji, because we're going to be very interactive today, sharing a lot of content. So we would love to hear from you. I am Melissa Talwar. I am the Executive Director of the Support Fibromyalgia Network, and I'm also a board-certified functional medicine health coach with additional training in functional nutrition and neuroscience.
And I am Brandi and I'm the co-founder of Support Fibromyalgia Network. I am also working on the families program for Support Fibro. I also am the blogger and founder of Being Fibromom and Fibro Parenting, which we have a lot of exciting things coming from the fibromyalgia parenting realm. So hello. I was dancing to the music, Melissa, as we were doing the countdown. I was like, I've had coffee recently, so I'm like, I don't have any moves, but I'm over here like dancing.
I want to know what kind of coffee Brandi is drinking, because I'm drinking coffee right now and it's not having the same effect. So
I'm gonna have to get you. I'm gonna have to get you some coffee. This is local organic coffee from Charleston, and it is super good and super gentle on my system. So I have to get you some.
Oh, that's perfect. Well, I see some like Ohio in the house. So let's say hello. Jan, welcome. Thank you for tuning in again. Happy Friday. It is so good to see you again. And then our people from Crystal, we have a lot of Ohio, so this is fun. And welcome, Susan. You're new. So let us know where you're tuning in from, Susan. We'd love to hear from you, and where you're tuning in from actually also on social media, because we've added some new. Oh, look at that.
I love Hilton Head. That's like the best vacation spot. I used to vacation there a lot when I was younger. That place is amazing.
That city has come up recently with other reasons. So thank you, Susan, for joining us. And thank you, Jan, Crystal. We are trying to do these regularly. I know soon Brandi and I will be in the same location in DC in June. So we'll try to do what we can to make logical sense being in person. But it's great to be here on Friday. And I know we have discussions that get started. There is a lot still going on. It is still Fibromyalgia Awareness Month. We are halfway through. We have news and updates. We have a surprise guest going to be joining us on Monday. We just found out last night. And so we're trying to prep for that. And I'm really nervous, but we'll get it together, because he wants to live stream. So I'm even more nervous. But it's exciting. So I know we have some stuff upcoming as well. And then also, I want to let people know, if you haven't yet, Unrest, the full documentary film, is available on YouTube to watch for free. It's a little confusing because you'll see still the buy and rent potentially on YouTube. But if you actually go to Unrest, the film's YouTube channel, the full documentary is available. I highly recommend you watch it this weekend. If you haven't seen it, it is a fantastic film. I don't normally get emotional when I watch movies, except for like movies that have animals in it. Like Benji the Hunted was the first movie I was bawling my eyes out. So, and then when dogs and cats get lost from their homes, those are what gets me emotional. But this film actually got me emotional. So
that's a really good film. I'm the same way, Melissa. When I see that there's animals involved, I'm like, I don't want to watch it. And it's like, oh, it's so inspiring. I don't care if they get lost or anything negative happens. I don't want to see it. But Unrest was actually very eye-opening for me. I watched it when it premiered several years ago. And I realized that there was a lot of overlay between fibro and ME. But it was the mitochondria that she was talking about, the science of it and what it does for the cells and, all that stuff. And that's when I learned about mitochondria dysfunction. So if you haven't seen it, go out and see it. Hey, my sister's here. Whoop, whoop. Hey, man. Sorry, I gotta say hi to her.
Working, it's streaming on your page. So are we streaming on Being Fibro Mom's Facebook page too?
Yes.
Yes. Okay. Yes. So hello, fellow parents and Being Fibro Mom friends too. So again, we're trying new things. We're always pushing technology to the limits over here, and sometimes it pushes back. But today it looks like it's cooperating. So That's
Next
exciting.
next week, we hope to be streaming live on Being Fiber Mom channel, the YouTube channel, because I had to request permission. So hopefully next week we'll be able to do that.
Well, that's exciting, and it's a new update for this platform in StreamYard, so it's something we're testing. But I'm glad that I know Unrest was really valuable for our advocacy efforts too, and inspiring us when it came out. I got a chance to see the live screening a couple of times, and Jennifer Brea was at one of them. One of the hosts for the Orange County ones, and the person that introduced us, unfortunately, is no longer with us. And so that's why it even has much of more of an emotional tie for me. And I got introduced more to the Open Medicine Foundation and MECFS through that individual. So it was a lot of the advocacy work that she was doing, and her TED Talk was phenomenal and inspiring. So it's a lot of what we're like saying here and following up on what we're doing. And just that Millions Missing campaign really resonated with me. I know I texted Brandi after watching everything, be like, we got to do advocacy like that. Like, how do we do that? And so I think I made everybody watch that film if they hadn't seen it.
But her TED Talk, when we were watching it the other day, when we were doing that seminar with the Fibromyalgia Support Network, that made me really emotional. I don't know about you, Melissa, but when I was watching that, I got kind of emotional because every time I listen to Jennifer Brea talk, it's just so inspiring. Her story is sad, but the strength that she has and the way she perseveres is just so motivating and inspiring. Everything she's doing, despite all of her setbacks, is just so encouraging. And yeah, it's helped us a lot. And yeah, it's really emotional to watch her story.
Yeah, I remember watching that TED Talk before and catching that because I think it was released before, and it was just you can just know that it was relatable to everything that we go through. And they make it she's very vulnerable in the film, and it follows her through that and what she's trying to manage with having a chronic illness condition that nobody understands. And they go through that film with it. And then just the aspect too of introducing Dr. Ron Davis and what he talks about, it was good for me to rewatch it because it was a reminder, everything he said of what we're doing on advocacy and him trying to write grants and then getting denied. But he's then talking, he's like, we got to push through, we got to talk to our congressional leaders. And this whole concept, which kind of ties into what we're talking today, is that he said we really need to change a lot of this language, right? If other people out there keep saying that fibromyalgia is not a real diagnosis, blah, 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 like all this stuff that is not the truth, then who's going to invest in something that's not real? And he says that in the film. So this was the advocacy work that they've been doing a really great job at doing for since that movie came out, but they were doing it before. And I think that was a huge highlight of all the work that they were going through. So it's important with the messaging as we move forward to be on the same page. And some of the language we use would be something that a dream that we could all get on the same page with our patient advocates, our providers. And then that way we can better educate our public health agencies moving forward, because fibromyalgia is very real. It's a real diagnosis. We know, all of us, it impacts our life in really real ways. So we just need to make sure that people understand it, update the language much better, because all genders, all races, all ages do get diagnosed with fibromyalgia. So there's some updates that we need to have.
Yeah, definitely. I did a reel on Instagram yesterday, just highlighting everything that we've done. I try to include like a lot of pictures from when we started this in 2019 up to today, and I am happy to say that there were so many pictures of us advocating in the last 3.5 years that I couldn't fit it all in that reel, and that made me super happy. I was getting emotional just putting it together and seeing everyone's smiling faces and just coming together, and it was like, wow, like Melissa and I had no idea how we were going to do some of these things that we're doing now. And look, fast forward it, and all of our community members came together, and the leaders and, patients and everything. We're just coming together and we're doing this. And we have done a lot. We still have a long ways to go, and Melissa and I have got a lot on our plates to try to organize it and, make some more changes. But I mean, we're getting there and we're doing it. And it's because of each and every member of the fibromyalgia community. And I also want to say one last thing before Melissa jumps into her other stuff is that if you want to get involved in changing our community, don't let the word advocacy and intimidate you and stop you from joining us. If there is some way that you want to participate in making these positive changes in our community, please reach out to us. Whether you want to do a little bit or you want to do a lot, you want to get a little bit involved or a lot involved, we have something for you. There is something for everyone to be able to help out. Everyone is valuable. Everybody is needed. Everybody is really wanted to be able to come together and make these changes. So don't feel excluded. Reach out to us and let us know how you want to get involved. And it doesn't matter where you live. Someone asked, is it only for the US? No, it doesn't matter where you live. Reach out to us. We have people all over the world.
Yes, and we're gonna talk more about advocacy next Friday with Crystal. So Crystal is the founder of Veteran Voices for Fibromyalgia and founder of the Fibromyalgia Pain Chronicles, and she has been a huge force for us and collaborator for advocacy efforts with these programs. So we're gonna have her next Friday. Tune in for that live stream with Crystal as well. So that is something to look forward to, and learning about advocacy, learning about the work that is going on, because we do have some special updates that, we're excited over. And again, we have to keep going back. We have to keep telling the congressional leaders what's going on, updating strategically. But it is exciting stuff to be able to do this.
Yeah, hardcore Crystal, man. I can't wait to meet her in person.
I know. So we'll be going to Ohio very soon. So let me see if I can share this desk. There we go. Okay. So I know I'm already struggling with my voice as it is. And I see Carrie here. Hello, yes. Carrie. I know Carrie has a special event as well. She's going to be, and Carrie, you're going to have to type it in the chat because it's a long title, but I know for autoimmune awareness that they have a race going on virtually. So I know Carrie is getting to participate in that. So that's exciting. And I'll have to tune in at the time she is. But I'm going to really do my best. Again, this topic is something that is near and dear to me and stuff that we're talking about right now. So I'm going to really try hard. I know Brandi's probably not prepared to ever see me emotional. So I'm going to do my best here. But this topic comes up quite a bit within our community when we get asked questions. Where can I find a fibromyalgia specialist? Who can I go see? And the honesty here in the difficulties of knowing that fibromyalgia doesn't have a specialty. So referring people, we're looking for the best case that we can at this point and the best provider you might have. They might not be fully educated on fibromyalgia yet, and I say yet, but we will be able to get the support that you need. And then providers do care. We just need to get you into the right place. But the search for a unicorn is very, very challenging. So I know many of you write all the time, like you're looking for the fibromyalgia specialist. So here's the challenge and stuff with that, because we don't have a specialty. So this is where we're going to just kind of dive in and discuss this a little bit more with some special announcements as well that I know Brandi and I are super excited about. And I forget what order this is all in. So I'm just going to roll with it when it comes to all of this. And I'm glad Carrie's posting. So it's World AI. So that's autoimmune inflammatory, not AI, by the way. I'm thinking AI. I've been using AI quite a bit, everyone. ChatGPT. I'm all about it. So I don't want to get everybody confused. Now, this conversation really opened my eyes. Now, I knew many of you out there were getting turned away sometimes from providers. This whole concept of the fibromyalgia and being a real diagnosis is bogus. So again, fibromyalgia is a real diagnosis. We face real symptoms. This is something that needs to be managed medically, not ignored. So when I got this tweet back in 2020, it really sparked something, because again, I knew there was difficulties and challenges in the medical system with all of you finding providers, but this one hit home a lot more, and just understanding that it was a university system that was turning people away. And I know I reached out, I didn't screen share, I didn't take a screenshot, and I'm disappointed that I didn't, or at least I can't find it, of the conversation that started right after this, because everybody started tweeting and sharing their experiences. And then I checked in with some of the advocates on the Support Fibro team. I'm like, is this for real? Like, our university rheumatology departments turning fibromyalgia patients away if you have an existing diagnosis? And so we reached out to some of these places in Texas, and they just don't have enough resources and evidence and research to be able to properly treat fibromyalgia patients. So they were deferring to primary care for the management. They could help diagnose fibromyalgia patients, but if you had an existing diagnosis, they just were not able to treat you. And I found out with Dr. Pinkston overall, and we have a good conversation with her in our first interview, that right now autoimmune diseases are just on the rise. Like, it is becoming, they're becoming inundated. So rheumatology offices are inundated right now. Now, we don't have enough rheumatologists to begin with, and pediatric rheumatology is an even smaller sector of that. So their offices are being overrun by patients with complicated autoimmune cases, and fibromyalgia doesn't exactly fall into this area. So this is going to be the challenge. And I just want to remind people too that providers really want to jump in and help us. But this is why evidence-based research, of what they say, evidence-based research, this is why research and advocating is going to be so important, because we need education for providers. We need an acceptance that we do need treatment, because right now we don't have a real home anywhere, it feels like. And to find that fibromyalgia patients are getting turned away from medical treatment is so devastating. And I know if many of you out there don't have support necessarily from family, you're looking for medical attention, you're looking for validation, and this can be so debilitating and depressing to all of you out there. And as of someone that's experienced this, it's hard. Before, I know I'm going to let Brandi jump in for a second, because I'm starting to get very emotional, and I apologize, because someone on this thread who was helping me make a call, I didn't know where she lived in the state of Texas, but I'm so sad but happy now that we get to find people like Dr. Ron, because she was trying to help me call the hospitals, and unfortunately we lost her in 2020. And suicidal ideation is super real. And this is Mental Health Awareness Month. And so this is why many of you out there know that Brandi and I are in a hurry, because I always feel like we're too late. We can't get to all of you in time. So please, please hold out hope. We are working so hard to make the changes we need. I know it's not going to come fast enough, but believe us, we're working behind the scenes so quickly to make the changes we need. And I know it's debilitating to be in pain. You can't sleep, and we're going to work on the provider end, I promise you. So let's get into some positivity here. Brandi.
Yes.
Texas.
Yeah, before we move forward, Melissa, I did want to highlight what Crystal was saying in the chat about fibromyalgia is no longer called a syndrome, classified as a syndrome. And this is super important. So when I first started doing all this advocacy work and awareness and trying to figure it out, because when I was first diagnosed with fibromyalgia, I had nowhere to turn. I had there was so much misinformation everywhere. And so it kept syndrome kept getting thrown around. And I'm like, why do we keep using syndrome? Like, why isn't it called this or this? So I literally got a dictionary and started looking through what each of these are, what does syndrome mean? What does illness mean? What does disease mean? Because that gave me some insight. So this is important that we know that it's no longer classified as a syndrome. And now it's this condition. It's really hard for me to say neurological. I have to say it really slow. But it's important for us to know that, because it will impact how we get that funding. It impacts how people are looking at us. And I don't mean from if it's real or not. I'm talking about from the funding level and research level. That's what they're looking at. So it's really important that we know that. And Yeah, like, so what Melissa is, I'm just giving Melissa a chance to just gather herself, but what Melissa is about to talk to you about, I know that there's a lot of stuff that goes on, and some of it's like, well, I don't know if that's going to help me. What she's going to talk about, if you live in the state of Texas, grab hold of this, try it out. You don't know until you're in it and you're experiencing it. If I was not in these group sessions and seeing what Melissa's talking about, I never would have guessed it was been so helpful. It is so very helpful. So just if you have any questions about what Melissa's about to go through, please post them in the comments. If you don't want to have them publicly, send us a message and we can answer those as well. But this is huge. Like what Melissa is about to say and about to tell you about is huge, not just for the state of Texas. Okay, this is something that Melissa and I are working to get for the entire country. It is a very slow process. Like she said, we're losing sleep. Like I was literally up at 2 o'clock this morning until almost 4 o'clock, just thinking about all these things that Melissa and I are trying to work on and how we can get other people to help us and move forward and get this care, because what she just talked about is very real. This is not the first time that has happened to us. Like there's been people that we have lost that we have known over the years because of this. And so we have to be able to do this. And so Melissa and I are only two people. And so that's why we reach out to the community and we have all these collaborations. And this is why we say, if you want to be involved in the community to make these changes that we need, because there's so many people that are just rejecting us, that we fall into this void of no health care. And that actually makes us worse. So while fibromyalgia is not getting progressively worse, the symptoms can make us worse. I know that kind of sounds like an oxymoron, but it does. So if we don't get any of that care, we can like end up getting worse and we just can't manage our symptoms. And then we live a lower quality of life when we're already having that. So yeah, reach out to us and you can get involved. Every single person matters. So reach out to us. You ready, Melissa? We good?
I think so. So
Okay.
well, we do have a special announcement, and I know a lot is happening in Texas, which we are excited about. And as Brandi mentioned too, this is something that we want to see scaled. So as a current board certified coach in group medical visits, this is what we learned about, and Brandi got a chance to see that as well. So in these group medical visits, it's billable through insurance. And so you're able to learn lifestyle modification stuff that helps. So things like nutrition, sleep management, stress management, movement in different ways, with the ability to be coached. And the coaches are supervised by another provider. So I was fortunate enough to connect with Dr. Ron and his team at the Texas Center for Lifestyle Medicine. Actually, Brandi and I were fortunate enough, and I was just like, he has a background in fibromyalgia. He had a passion for it. He actually got into functional medicine and integrative medicine because of fibromyalgia groups. So I was so excited. I told Brandi, you got to come in here and like, you got to meet him more. And so this is huge for the fibromyalgia community. And it's big news for someone like Dr. Ron's level and caliber to take this on, because he does train other functional medicine and integrative medicine physicians around the country. He has programs. He is training and looking for more providers that want to scale group medical visits. And he does group medical visits for all kinds of different chronic illness conditions. So fibromyalgia, chronic pain, dysautonomia is another large one in his office, Alzheimer's, brain health, diabetes. So they are very well versed on his team. And again, we put collaborative care here because that's what it's all about. So you get to interact with him as an MD, with other MDs on the staff as well, the NPs, the nutritionists, dietitians, health coaches, the full team. So you are well supported with a community of a medical clinic that does care about you. And then you get to interact with other community members. So you really know that you're not alone, and you go through this process together, these pillars of health. And I cannot thank him enough, because he is the most responsive provider I've seen, with amazing listening skills. And I think Brandi can attest to that too.
Yeah, I feel like a bobblehead over here, because every time we do a video and Melissa's talking, I'm just shaking my head because I agree with everything she's saying. Dr. Ron is phenomenal. Like, when Melissa first told me about him and, we were going to have a chance to work with him and everybody was talking about, how big he is and how big he's doing, like all these things he's doing and stuff, I was like, let me check him out. So I went on to social media and looked, and I was just like doing the same thing, like bobbing my head, like agreeing with everything he was saying. And then I got to actually be in one of his groups. And at the time I was just like, I was in charge of like just making sure that everybody could get, onto Zoom and make sure everyone didn't have any issues or any stuff like that. So I was more or less like an observer and be there if anyone needed help with their technology. But I got to see firsthand how Dr. Ron interacted with everyone, including me, because at one point, the group wasn't really saying anything. And then I said something, I put in my 2 cents of what I did. And he was like, oh my gosh, like, you know what you're doing by doing that one thing. And then he connected all these medical things that I was doing. And I was like, I had no idea I was doing all that. And he was like, yeah. And he was like really encouraging. What I love about him is that he remembers all of his patients. He remembers everyone. He is a really good listener. He gives feedback. He genuinely cares. So you don't even realize that he's the medical provider sitting in the group because he doesn't have that air about him. And this is not to say that all providers are like that. That's not what I'm saying. What I'm saying is that he's very approachable. And when Melissa says he's engaging, he is truly engaging. He asks questions. Like he just is like another group member and he just wants to know, and how can we better? We've had a chance to have a conversation with him outside the group, and he was talking about like the fibromyalgia conference and this and that, and he was just so encouraging, and he had a real interest in fibromyalgia patients, and it was so refreshing. And I got off the phone and I was just like, wow, this is mind-blowing. Like he's so much more phenomenal than I thought he was. So again, you do not know or understand until you actually are in these groups. He's not one of those people that just sets up groups and just walks away. He's in the groups, he's engaging, he's giving tips, he's talking, he's highlighting points. And this isn't just a group that you just sit in and you listen to someone talk. Like everybody gets a chance to talk and interact and share. And you're in a community of other people that are going through the same exact thing that you are. So it takes away that vulnerability. It takes away that I don't know if I want to say something, because everyone in the room is experiencing the same exact thing. So it gives you that encouragement and that confidence to speak up and say, hey, I'm having this issue, or you get to learn from someone else. So I don't want to go on and on about it too much, Melissa, but I can't really say enough about this. I mean, you know how it is.
Well, and then the brilliancy of the model that he's building is that they accept insurance, which I know is huge for our community. And he has a long list of insurance providers that he works with on the website. I know some of you have asked me, and I still know, even though he accepts insurance, if you do have a copay, that could still potentially be a lot for people. But I do encourage you to check if you do live in the state of Texas, because this is a virtual group. And you're not required necessarily for like the attendance. It's not like going to school, just to let you know. It's not like going to school. It's not like going to a regular doctor's appointment. So you can join in, see if your insurance covers it, what the charge is. Some people can join these groups for no cost at all, and you are really going to benefit from it. Just the interaction, there's always a takeaway. Even myself, everybody knows I'm pretty nerdy, but when content is shared from his providers, I always learn something. And even when Dr. Ron is in the groups, I let him have the floor. And you really have, like, what we're talking about here is everybody feels like they're missing this medical team. This is your medical team right here. Is a fantastic medical team that's available. They are based in Houston. So if you are in those areas too, you can really utilize their services more. But remember, collaborative care, it is based in functional medicine and integrative medicine roots. So they are looking more at getting the root cause rather than just managing symptoms to really help you improve quality of life. And they do accept insurance for the state of Texas.
It's phenomenal. What I used to explain to people when they would ask about what is this group care, I would say, you know how when you walk out of the doctor's office, they've given you this list of like things you need to do, like eat this, don't eat that, move. I don't like to say exercise, but move more, and you got to get better sleep. And it's like, yeah, okay, we know all those things, but how do we actually apply them in our day-to-day lives? Like, we don't live in this perfect world where we can just say things can happen and they just happen. What this group does is it gives you that support that you need to make all those changes and how you can make those changes. And it's not going to happen overnight. Y'all hear me say that all the time. It's all about baby steps, taking it a little bit at a time. That's what this group is doing. It takes it a little bit at a time and helps you engage in your own healthcare and improving those areas that are most important to you, and along with what your provider is telling you to do. So when if you're feeling lost when you go outside of your doctor's office, which many of us do, and you don't know how do I apply this in my day-to-day life? This is it. This is how you're going to do that. Because it's not about sitting there saying, oh, you got to do this and you got to do that. No, it's like, these are things that we can do. Let's explore how this can apply in our day-to-day lives, because that's where for me, that's where it gets hard. It's like, that's great, I learned it, but now what do I do with it? How do I translate that into my life at home with my kids and all of that? So this is if you're having those kind of problems, you can relate to this. Give this a try, see what happens. I mean, why not? Just give them a call. Just call the number and say, hey, this is my insurance, or I don't have insurance. How can we help? Just figure it out. Just call them. They are a phenomenal team. Melissa has talked to multiple members of everyone in the clinic, and they are all so nice and so just, I can't even explain it. I've never seen provided like a whole entire team like this before. So just give them a call.
Yes, and I have visited the clinic in person, so I can verify that in person and the energy there. I got a chance to take classes with Jenny in person. She is the real deal for mind-body coaching. I know some of us, like myself, are very cynical when someone says that, but there are a few people that when you really understand and take a class and know their energy of where they're at, she's the real deal with that. And I know we'll probably have to share her Instagram because she helps. If I'm scrolling through Instagram, she has a breathing meditation and it makes me stop, and it's helpful. But everybody at this is well versed. Like Ruben, the dietitian, oh my goodness, his background is phenomenal. And when you learn more about him too, you understand his passion for helping patients. So I can't say enough about this. And I know Texas also has swing care, right, Brandi? So that's another,
yes.
What is happening? We need to need to talk to everybody out there. We need to scale. So I know I'm bugging Dr. Ron on scaling this across the country. He's in because that's his goal. So he has said that. So group medical visits. So if your provider wants to learn, first of all, group medical visits, because it is billable to insurance. So if you have a provider that's feeling a little bit burnt out or doesn't know how to take care of all the fibromyalgia patients they're currently seeing, and they do take insurance, this is a great way to help their business as well. But we also have swing care here. And I know Brandi has used a lot of their features and has been helpful with their app, right? So digital healthcare is this huge concept, and they're available right now in Texas as well. And they also do take certain insurances, and I'll update myself on that as well. But I know, Brandi, you've used the app and they've gotten a lot of attention recently too for progress that they've made.
Yeah, definitely. Shortly after my sister passed away, I was having a lot of issues with just trying to be able to just cope. So it took a huge mental hit to me to lose her. It was very unexpected. I mean, it was just like she was in the emergency room. Within 24 hours, she had passed. So it's just very sudden. She was my younger sister. I had 4 kids. So it was a huge hit to our family. So trying to grapple that was really hard. And what I didn't realize at the time, it wasn't until I was looking back that I realized that my mental state is really affects how my physical state is. And that mental anguish was really coming out in a fibro flare. I was really withdrawn from people. I've actually lost some friends because of it. And I was just trying to just survive. So I started seeing a psychiatrist through the VA, and he was helping me and he was trying to get me to do some stuff. But then I signed up with Swing Care to try out this digital therapy. And I was like, why not? Like, I really need some help. I want to get back to myself and be okay again. And so I tried it out. And it was just, it broke through some barriers for me. I never thought I would be the type of person to just sit and meditate, like our breathing exercises. Like that's just not me. To get me to like sit and get my mind to be still for that long, it's really hard. I'm one of those people, like I go to take a shower, but then I hit like 20 different places on the way to the shower and I do like 20 different things. That's me. I can't keep it focused. So this app explored all of that. So one week we would try, let's try meditating this way, and we would do it. And then the next week was like, let's do a visual exercise and, do it that way. And the next week was breathing. So they tried all these different things, and it was really hard at first. But then because they tried different approaches and they tried it in different ways each week, and we started off a little bit, like 30 seconds at a time, and then a minute, and it kept increasing. And now I can do it. It was helping. So that, along with the care I was getting through the VA, it's really just pulled me out of that. And I just couldn't say enough to the Swing Care team for stepping in and helping me the way they did. I was in a very dark way at that time, and I couldn't see my way out, and it was just really hard. And that really stepped in, and it was able to pull me out. And then earlier this week, I was on LinkedIn and I saw that the CEO made an announcement that the FDA, correct me if I'm wrong, Melissa, but the FDA approved that app to be used in digital therapy, correct?
Yeah.
That's huge. That's huge. When I saw that, I got goosebumps. I immediately private messaged the CEO and was just telling him how much that app had helped me and pulled me out of that space and got me, back on track again and going onwards and upwards. And so I was thrilled. And every time we talk to Dr. Chadwick about stuff too, I mean, she's phenomenal. She's a researcher, which Melissa and I love research. So that's been the whole entire team. I mean, yeah, Texas has got some great stuff going on. I was telling my husband the other day, maybe we should just move to Texas. Like, we'll be closer to Melissa, and they got some great stuff there. But we're holding out in the Carolinas to be able to pull it over this way and be able to do stuff here, and we're working on it. So I'm really excited about this.
Well, and Swing Care has mentioned that they will be able to be in more states by the end of the year. They haven't revealed what those states are. But with sharing all this information, and we have more providers to share with you as well, is please, if you can, support these initiatives by these providers, because they are saying fibromyalgia, whereas they will get snarky remarks sometimes from other providers. So if we can rally around everybody, we will be able to expand care. So this is a request, a call to action for all of you. So right now, if you do have friends in the state of Texas, please share these resources with them, because everybody can benefit. And then also let these organizations, so let Texas Center for Lifestyle Medicine know, let Swing Care know that you want them in your state as well. So that way they know that there's also a demand, because we do need to expand these services. It's super important. And Dr. Chadwick is the medical director of Swing Care. She is a practicing physician. So I forgot to put her face in here. I'm sorry, Dr. Chadwick. Brain fog and a lot going on this week. But she is in Kansas City, Kansas. So if you are there, she does do research, but she's also a clinical doctor. So you can see her as a patient. So this is what we're trying to do, is find these providers that will accept and welcome fibromyalgia through the door and actually have a good rapport with their patients, are educating other providers. And we definitely need to scale the education piece. I do have Dr. Pinkston on this list. So she is also a medical provider. She's a rheumatologist. And I know with her practice, she definitely works with more of the autoimmune patients, but she has a podcast for fibromyalgia. She shares a lot of information for fibromyalgia. So I did want to add that in again. Roomcoach.com. She has a great program called Roommate. And I've heard fantastic things, like everybody loves her videos. Everybody loves working with her when they get the opportunity. So I know that this is huge, and I want people to lean into this positivity, because there are providers out there. We may not even know about everybody yet, because connecting with Dr. Pinkston has been recent. Connecting with Dr. Chadwick has been recent. So there are many, many people out there, and maybe they're not necessarily calling themselves specialists in this field, but they are very, very open, and they understand fibromyalgia very well too.
She has a podcast too.
Yes. Well, Mind Your Fibro, which is the podcast. And so please go subscribe. She's in season 2. I feel bad, Dr. Pinkston. I hope I didn't. So we sent an email just to check in, and I don't know. Please don't feel pressure that you had to do season 2, but I feel like I feel a connection with Dr. Pinkston with our ways, and maybe eventually down the road, I can do some training with her if I become a provider as well. I just feel like our connection for our work and our science background there. So I appreciate her so much. She's an incredible medical provider.
Well, I want to interject to say I like that you talk to all these people, Melissa, because she might not have had intentions to do season 2. She might have, but just how like we feel as though there's nothing we can really contribute to the community. I think sometimes these providers feel like there's really not a demand for what they're putting out. But when we email them or we talk to them on their social media accounts and we're saying, yes, like this episode helped me, or what you said about this helped me, and what you're doing has helped me, when they know that they're out there and they're helping people, it gets them motivated to keep on. Because sometimes it just sounds like you're just speaking into a void and no one can hear you. And, everybody's listening, but I'm just talking about like us personally. We can feel like that sometimes, like, especially as a mom, like you keep saying stuff, kids aren't listening, but they're listening. But you just have to let them know, like, hey, like, we're here, you're helpful, we love what you do. Just show your appreciation, I guess, is what I'm saying, that it is helping, so they know that what they're doing is being reached by people and it is helping. And we need to motivate them because, like Melissa said in the beginning, there's so many providers that just aren't able to help us. So those providers that are in our realm, let's rally around them and let's lift them up and encourage them to keep doing what they're doing, because they're helping us.
They're definitely helping us, and they're giving us a lot of positivity. And then if other providers see that they're in this with us, then that entices other providers to join, because they're like, oh, I'm curious, you have this podcast and I see people rallying behind you with a lot of positivity. I wasn't sure if I should talk about fibromyalgia, but I'm getting a lot of patients with fibromyalgia. So maybe this is a conversation to have. And this is something we're working really hard to do at Support Fibro, is not only building a community for patients and patient advocates, but building a community for medical providers, allied health professionals to come in and teach each other what's going on with fibromyalgia, updated research, updated diagnostic criteria, and then build a community around that so they can feel well supported. So exactly what Brandi said with this. And I know Dr. Pinkston also has a YouTube channel on the Support Fibro channel. Her video is the most watched video we have from the conference. So I know, and I'm seeing all the positive comments. So please keep leaving comments, keep sharing about these providers, because they're very invested, and we need more of that, and we need to rally around the ones that are invested.
Yes, absolutely.
And then shout out to Dr. Michael Lenz. I know you see him too in different Facebook groups. He's always sharing information. He's always asking a lot of questions, and he has a book. He has a podcast out on fibromyalgia. He wants to do more. I saw him, and I didn't get a chance to join, but he was hosting a creativity group because he got really intrigued by the creative aspects that were going on with fibromyalgia. He was a speaker at the conference talking about sleep. That's also a very popular video because we're all intrigued with sleep. And his background is incredible as well. So shout out to Dr. Lenz. And I see him posting, and I see him like also gaining traction. So please rally around him as patients out there. He is a clinical provider too. He does work with fibromyalgia patients. It's in the state of Wisconsin. I can't remember the exact city, but definitely he still sees patients as well. So this is another great resource out there, and another great face for fibromyalgia treatments too. And then I just wanted to go through, because we do have a shout out. So this is from the conference. So what we really did was trying to share with everyone that there are providers out there. I know sometimes we forget because we don't necessarily have the provider right next to us or aren't seeing the provider that we need, but there are providers. And how can we grow this? This is going to be the major question of this next decade for fibromyalgia. Let's grow this. Let's make it stronger. And I know one of our goals here at Support Fibro is I want to see at least one, and I would love more, at least one trained provider who has at least medical knowledge on fibromyalgia who takes insurance in every single state. So at least one. I would love more. So that way you don't have to travel out of state. Because I know how that is, traveling across country, traveling across state. I did it before to try to meet the specialists, the unicorns. So let's give you someone in every single state to start with. That's the first goal. But we have Dr. Rutherford. So he's in Reno, Nevada. He does have a basis of functional medicine. We have naturopathic doctor, Dr. Silva. She's in Oregon. Dr. Matias is actually in Covina, California. So these are all people that treat patients. And Dr. Tracy, also, she's a chiropractor. She's a fibromyalgia warrior, went back to school to become a chiropractor. And I think she moved to, we have to check in with her as well. If she moved to the state of Florida, she was in Pennsylvania. And I know Dr. Silva and Dr. Rutherford did manage fibromyalgia and other fatigue components and Hashimoto's. Dr. Silva, EDS, fibromyalgia. So these are chronic illness warriors that have gone into the medical system and they still actually clinically treat patients. There are other people that have stopped clinically treating patients, which we have talked about before on this channel. But I wanted to give a shout out to the providers that are still in the game clinically treating patients, because we need more of that right now. And I'm probably missing some. So if we are, please definitely post in the chat. Okay. And then for Dr. Roger Murphy, shout out to him. He's also treats at yourfibrodoctor.com. So you can do a consultation. He works with fibromyalgia patients. And the summit is coming up for the Freedom from Fibromyalgia Summit. It starts on Tuesday. It's all virtual. You can watch it for free on those particular days. I know Brandi and I are going to do recaps on what we're excited about. But these are also all providers in here. They may not specialize in fibromyalgia, but they might be better fit for maybe an underlying cause of what's contributing to a lot of pain and other symptoms for you. So it's exciting. And of course, my bias on there is Dr. Terry Walls, who I can't talk about enough when it comes to treatments.
Well, who sat on the second row, second from the left? She looks familiar. Melissa is going to be talking at the summit as well. These are all really great topics. This is a free event to join, so go ahead and make sure that Melissa is going to post the link so that way you can get on to this free summit. But I was looking through all the topics and there are so many good topics on there that I was like, okay, which ones do I absolutely not want to miss? Because this is going to be a week long. And it was just really hard to choose. I'm like, I'm just going to have to end up in trying to watch as much as I can. But this is something you're not going to want to miss. It is free to join. So make sure that you use our link to be able to sign up for it.
Absolutely. And on Monday, if you tune in to a special broadcast at 6 p.m. Central Time. So that's 7 p.m. Eastern and 4 p.m. Pacific Time. We will be doing giveaways with our special guest for this summit. So you have to tune in live. We'll have maybe some trivia questions or something. I haven't figured it out, but we are going to do giveaways. So you'll be able to get the Freedom from Fibromyalgia Summit as a giveaway item, as well as maybe some other gift cards and those things. So tune in on Monday evening at 6 p.m. Central Time for a special presentation, guest, live stream, giveaways, conversation. We'll see how it goes. And I cannot remember anything that I really talked about on the summit. So to anyone out there, there was so much to talk about with fibromyalgia, like my brain and I was really nervous. So I hope I make sense, and hopefully I'll make sense for all of you.
Yeah, I'm going to be joining on there as well. Melissa messaged me and said, it's going to be at 6 p.m. Central Time. Are you going to be awake? Because that's 7 p.m. my time. She knows I try to go to bed as early as I can. I may not be sleeping, but I try to get in bed as early as I can. So I thought that was funny. I was like, yeah, I'll be awake for it. I'll join.
Well, it's it's 2 hours, so it's 4 p.m. my time. So I know I'll be around. It's kind of perfect, but for everybody else. So for those of you out there, come back to our channels on Monday at 6 p.m. Central Time, because we definitely want to give away some of these. I guess it's not a kit. I almost called it a kit, but you'll get access to this for the whole summit, so you don't have to necessarily watch every single day, but you'll get access to all the videos. And please do, if you register, when you register, download the free guide. So I always tell people that you may not read everything right away, but just save them into like a Google Drive or something like that. There's a lot of PDFs, bonus gifts that you can download for free once you register, because it is free registration to claim your free spot. But Google Drive so that I can read later and reference later, because you don't have to read everything all at once. But since they're free guides and we're always looking for more information, please do take advantage of those bonuses. Okay. Anything else to add, Brandi?
I don't think so. Yeah, just go over to YouTube. Make sure you subscribe to our YouTube channel so that way Melissa's really good about uploading all the various content videos that we have. She even, these that we do on Friday, she puts those over there as well, and they're very valuable. So while you may not be able to watch them right away, like she was saying about, just downloading for later, make sure you go over there and turn on the notifications. So whenever we do upload something, you'll be able to get it. Like and comment on those videos. Like sometimes when I listen to my kids watch YouTube videos, I get kind of tired of them being like, make sure you like, make sure you subscribe and da-da-da. But I know they're doing that because that is how you spread the awareness. That's how you get more people to your channel. So I'm shamelessly asking you to do that because we need to get a lot more people to be aware of these providers and be aware of what's going on out there in our community and how we're working to build a stronger community, and just be together and be collaborative. So yeah, go over there and subscribe and like notifications.
Well, and those of you on Facebook too, please share the content. Please follow the pages. Just like Brandi mentioned too, this is something that fibromyalgia warriors all out there need to know exist and need to know that people are working hard. We bring in a lot of community collaborators to share with us. So again, we really want to emphasize that people are not in this alone, because it is devastating and debilitating. It can feel extremely isolating. So to know that people are really working behind the scenes, we're real, hello, and we'll meet some of you in person. So we do exist, but we just are not as maybe widespread all over the internet because of our personalities as maybe we need to be. But if you could do us a favor and definitely follow our social media pages, share the content. Brandi has some more upcoming content that I'm excited about to share with families, families living with chronic illness conditions, families living with fibromyalgia. So it's really important content. And we've also been getting more youth content out there because I'm super inspired by it. And I see a couple of people. Yay, Danielle. I can't wait to meet Danielle in person soon. I'm going to be bothering her and her family quite a bit. They'll be like, who is this Melissa that keeps showing up at our door? But Danielle's family is so awesome. I see her mom and dad commenting on the post. It's so cool to see. And I know this person because I know who you are. Another one of my favorites. So someone else that we're going to have to visit in Mississippi. And I'm so happy that she's singing out in public. And we're going to have to go see a live show, Brandi.
Yeah, that's close to us. I was gonna say that. I think you were saying that one of the providers are now down in Florida, and that's closer to me. I'm trying to get Melissa over here to the Carolinas, guys, so that way we can go around North Carolina, South Carolina. We're trying to get over to Alabama. Now it looks like we might be going to Mississippi and then go down to Florida. We got a lot going on, so that's what I've been trying to do to kind of piggyback off of what she was saying about building content for family stuff. Is that Melissa and I are meeting up in DC at the beginning of June, and we'll be together for about a week and a half or so. And while we're together, because we're not really together in the same room a whole lot, even though we've known each other as long as we have. And when we're together during that time, we're really going to be able to have that time together to be able to flush out a lot of things that we've been trying to work on. So in between today and when I actually see Melissa, I have been really just buckling down and trying to get some stuff flushed out for fibromyalgia parenting, which is near and dear to my heart. I've been working really hard, bugging Melissa about so many different things, like helping me out with that. And that way we can go ahead and just get it launched and ready to go. Because I know when I see Melissa in June, it's going to be buckle down, get stuff done, try to travel around and visit with people. So I want to be able to have that content as much as possible possible. And we do have someone asking about San Diego, California.
San Diego, California keeps coming up with resources. So the challenge here, and I always ask people when they're looking for a medical provider, you might have to make a distinction on whether you need a medical provider that's covered, that takes insurance. So I know this is going to be a huge challenge, and this is what we were trying to shift, because even at the conference, I was looking to bring on more medical providers that took insurance when they have fibromyalgia related programs. So this is something we do research for. I do know that there's some great naturopathic providers in the San Diego area, but unfortunately, they do not take insurance. There might be ways to get it covered with some strong advocacy work on the payer side. Like you might have to bug them to get some fees covered. And if with super bills, that could be possible. But we are looking for these resources. I think unfortunately, people assume a lot of resources are in California, and they're just not. Like it's hard. I live in Los Angeles County. I'll be moving to Arizona soon enough, and it seems like Arizona has more providers than where I'm at currently that actually understand fibromyalgia better. So
we'll see.
But I mean, for those resources too, and again, just a reminder, I know specifically people are looking for specific locations, but in this video, we have shared resources that you can use. And Brandi and I will be doing some more webinars and online virtual group community work where we talk more about patient education and health coaching. So please utilize those resources, because again, we're looking locationally. I know we're not medical providers and we can't fill that, but there is other things that we can share with you that you can do to at least do while we're trying to locate and track down, like honing pigeons, a medical provider for you. And then also we do talk about how you can work with your primary care physician in your city to better give you care. Even if you're diagnosed with fibromyalgia, they don't have to be experts. You can still work with them. And we talk about this a lot. So these are things that we advocate for. So again, trying to reframe everyone's thinking right now, because there isn't a specialty, but you still might have providers that are very, very equipped to helping you, give you adequate medical care, even if you are diagnosed with fibromyalgia. So we talk about this a lot, and we'll give you tools moving forward. So branch out with the virtual side, get some more advocacy education, and we'll be able to support you no matter where you live around the country too.
And Sabrina, thank you for letting us know that you need help and resources in your area. If you don't want to put it there in the comments of what exactly you're needing help with, send us a private message. And I encourage everyone that's watching this, to let us know specifically what you need help with. I'm not asking you like to give specifics of your health, but just say, hey, like I need someone to help me with sleep in this location, or I need help with more of, the cognitive therapy, whatever you're trying to just like broad areas. So that way we can have more pinpoint. Melissa and I are just like, like trying to get all these different spots. Cause we know it's all important, but if we have all of you coming to us and saying specifically, this is what I need in this area, that can kind of, like she said, like help us hone in on that area and see what's in that area. And that is going to help us in the long run. So everything that people tell us they need help with, there is someone else that needs help with that as well. So once we can hone in and find that person to be able to help us, and we can share it out to the community. So there you go. You're helping someone else. You're helping and contributing to the fibromyalgia community. So this goes back to what I was saying about no matter where you are or what you feel like you can help, you can help. You can do something. So everything that we do, even from our personal experiences, we try to find resources for and education for and get it out. So this isn't, what was it, Melissa? Like we're not in a silo. We're like actually branching out and collaborating with all kinds of people through our community, providers, everything. We're just doing everything. So hone in on that for us and let us know.
Absolutely. Let us know, because with connecting and collaborating with so many advocates in different areas, we might be able to ping, like we may not remember, but we just be like, hey, do you happen to know someone? Because I know I'm going to reach out to the Orange County support group to see who's there, if there's anyone in North Orange County, which isn't necessarily San Diego, but it's right down below, and see if there's any resources too that maybe are updated that we can provide people as well. So we're just all trying to collaborate as a community together.
Definitely.
Well, I think that's it for Friday. I know we always go longer. How do we get this under? We're trying to get it under 30 minutes, but I think we're educated. Next week, we're going to be talking about advocacy. So please join us with Crystal to talk about advocacy. Don't miss Monday night at 6 p.m. Central Time, and we will talk to everyone soon. Thank you so much, everyone. Happy Friday, and bye for now.
Bye.